Hello, everybody. It gives me a great pleasure and honor to introduce Ms. Carol Jabari, who specializes in designing and implementing cancer project screening program, health education projects for health professionals, and the public and psychosocial support groups. She has established cancer support groups in Palestine and Jordan and is the Middle East representative for Reach to Recovery. Ms. El-Jabari is an advisor for a global focus on cancer, served as consultant and advisor to the Health Authority of Abu Dhabi. Susan G. Komen for Cure is a member of the Mediterranean Task Force for Cancer Control and an advisor to the Board of Trustees at Hebron University. Carol's research includes examining factors affecting screening, patient satisfaction, and quality of life, among others. She has several publications on these topics. She is affiliated now with the Patients Friends Society Jerusalem at Hebron University. She will be sharing with us her lecture on breast cancer advocacy.
Hello, everyone. First of all, I'd like to say thank you to Dr. Shaheen for inviting me to this first multidisciplinary cancer meeting in Gaza. And I'm sorry I can't be with you in person, and I wish I was, but nonetheless, I hope you can take advantage of this presentation about breast cancer advocacy. Dr. Rula was asking me to share what works and what doesn't work. I've done a lot of this over the years, so I hope this will be of benefit for you. So first of all, let's identify who is an advocate. Okay, so it can be you, your neighbor, your colleague, your relative, a patient. We can all be advocates. And we find most often that nonprofit organizations and community groups are more into advocacy, or if you like to call it activism. So we want to bring about what we think are positive changes. So here you can see people from different backgrounds, different gender coming together to be advocates. What is health advocacy? The focus here is health. So it is to help patients and caregivers. So a relative is a caregiver, a health professional is a caregiver. So we want to get around the system or through the system. And different points that we might feel keenly about are access to care. Like our relative or our patients aren't able to reach us. So we want to advocate for change. Or there are funds coming in or there aren't funds coming in. So what can we do to raise money or use it in the best possible ways? So these are ideas to think of or to plan for. All of these points that you see here are really to promote human rights, because health is a human right. We all know that. And we also want to overcome health inequities. We want to make sure the rich, the poor, the old, the young, the short, the tall, whatever, we all have the same right. We're all equal to have a standard of care. And other topics that we can address are to influence health policy and create some change in the system. Like we find that a medicine isn't coming as often as it should do. So we can come together and petition, we can advocate for change that we really need this medicine more frequently, or we need a better road to reach the hospital. These are all different examples. Principles of advocacy. So we need to make sure that there are safeguards in place, that the topic isn't controversial. Well, it might not be controversial to us, but it could be to the policymakers. But no, we need to make sure there's safeguards in place. But we're always putting people first. We want to serve our community. We want, whether it's patients, whether it's nurses, whether it's firemen, we want to put them, who we've chosen as our target, to be first. We have to be clear in what we're trying to achieve. That's very important. If it's a vague campaign, for example, people will be lost and it will fail. We want to empower the advocates. We want to empower the people we're trying to serve. And we can also empower the policymakers. And if we get more people on our side, then our campaign will be more effective. But again, we're back to equality. We're all equal in this. We should all be equal. And here in the picture, you can see we have people from all walks of life, ages, gender. We're all equal, but we all also are diverse, men, women, tall, short, as I mentioned before. So we need to embrace that. So if we have, for example, a handicapped person that comes and they're able to participate or assist, why not? Why not? Diversity is good, and they will be even stronger advocates. It's just one example. Advocacy methods. There are many ways that you can have an effective campaign or initiative. So networking is key. Not just you and your colleagues sitting in a room and that's it, you're dreaming up something. No, you need to network other professionals, other people that are like-minded, that want to share in achieving X, Y, or Z. So you can take your advocacy online, and we're all familiar with Facebook and TikTok and Twitter and et cetera, et cetera. So we can utilize this, and you can see how effective it is in many campaigns around the world. Printed materials. So these can be effective. They take a lot of time and more resources than sometimes we have. But in my own work, these are examples of what we've used. And it's really good for people that are marginalized, that don't always have access, or maybe not so well educated. Their daughter-in-law, their brother, somebody can help read them to them, or not everyone has access to the internet. We don't always have television or electricity, right? So this is a way to reach people, and it has been effective. SMS. If you're going to use SMS, again, you're going to need a special budget, but this is another way to remind people and reach a lot of people, more people than you would reach perhaps standing on the corner outside the school. But for us to have effective campaigns, we mentioned we want to have a multidisciplinary approach. And the people that join our campaign as leaders need to be trained. They need to understand the topic. They need to know it inside out, if you will. Not just say, oh, we're here talking about breast cancer. Oh, well, what about it? How many cases do we have a year? Well, I don't know, but it's a killer. No, people should know the data, et cetera, et cetera. So the training doesn't have to be a year-long training, but to get the basics in so that people will say, oh, wow, these people know what they're talking about, and we want to join them. So your initiative. So you and your friends have decided that you want to do this campaign. You need to collect the data. Okay, so we know breast cancer is serious and the mortality rates are higher than they should be. So we need to go out there and define that it really is serious and get the data, right? As I said, people need to see that you know what you're talking about. All right, we're going to plan. All right, we've collected the data, the team is all together. Who are we going to talk to? Are we going to talk to schoolgirls? Are we going to talk to schoolboys? Are we going to bring all the imams in? Who are we going to talk to? So you will gear your campaign or your initiative to your audience. All right, so we've identified our issue and we're going to implement it. And again, we're engaging with key stakeholders and we're using the radio. Radio is great, the social media, but here we're gathering at a university, so you need to have a plan where you're going to go, who you're going to talk to. Maybe your target is just university students. You could use the university radio station, for example, have meetings with the students, etc., etc. You can take your leaflets and distribute it. But the people standing there need to know what this initiative is and all about, for example, breast cancer. So measuring and evaluating is really important, not just say, oh, wow, whew, we did it. Let's go home. Well done, us. Wasn't that great? We had 10 people at our lecture. No, so all the time you're measuring. Like today I was in Khan Yunis and I had 50 people, or I was in Beit Hanun and I had 200 people. So what was good, what was bad, what worked, etc., etc. So did you meet your targets? Did you see the people that you wanted to see? All these things come into play. It's all important. So all the time, measure and evaluate. So here we have example of initiatives. On the left, you can see this was a Patient's Friends initiative. And we learned from a colleague in the United States who traveled in various parts of the world. And she found that a photo exhibit of cancer patients and survivors was really effective. She used it in Southeast Asia, in Africa, in Washington, DC, and she came to us in Palestine and she took these beautiful photos. So we put together this campaign. So this is just an example. And what's really good, it's cost effective and we can take it anywhere that we go. So this is just one example of a way we learned from her. So you don't have to reinvent the wheel and you're using your own people. So that's really important. And it's important for your community and for outside so they can see what the situation is. And you can see with the pictures here, we have a little vignettes, little stories that each patient took or each survivor. Then here's our Gaza example. You had a campaign in October 2021, and this was from Reuters. I took it. So I don't know how effective it was, but I see from the literature that you have better awareness, breast cancer awareness in Gaza than you have in the West Bank. So well done. But it's still amongst all the people, it's less than 50%. So we still have a long way to go. It's not a one-off. Health awareness, for example, it's a continuous process. And it's hard work and it doesn't end and you keep saying the same thing, but you can rearrange it, if you will. Okay, so maybe this year you've got the truck, the mammograms or the lectures in a truck or whatever. So maybe next year you've thought about it and you will have it somewhere else. You will go to kindergartens and bring the mothers. So here on the bottom is the one that we engaged with students, school students and university students, employees, and to raise awareness. And this was in Hebron. And it's just a short clip. So the amusing part of that one was people aren't used to seeing breast cancer being marched down the street. So the shopkeepers came out and said, oh, which political party is this? But anyway, we did raise awareness. We engaged with the community. We had teachers, we had professors, we had the scouts, we had lecturers. So it was really wonderful. And it helped us to engage more with the community. So here, I'm closing now. Here's a checklist, some of the points for you to take home. So only have one main topic. Don't have, oh, breast cancer awareness and screening and prevention, and you need to have one major topic that you're going to focus on to be most effective. And remember, if you decided you're going to do early detection, why did you choose that? And what is the data telling you? You need to collect that, really we're not meeting the targets, that we're not having enough women screened. And we know screening can help save lives. So this is collecting the data to show the community or physicians or policymakers, whoever you decide, okay? Engage with each other. You can't do it on your own. If you want to be big and powerful, you need to have that multidisciplinary approach. And remember to engage with patients and survivors. Their voice is so important. And more you'll see in articles, in conferences, that they're coming in to share their story. Sharing their story has been so effective. And I'm sure you had examples from Gaza in the past. I think it was Fatima showing her story. They used that story. Inspire, be creative. It could be you want to talk about early detection. So you could do it through art or drama. You could have a play, maybe students, university students, high school students will come together and put together a play that can go around the country. You can have a catchy phrase like, I don't know, help us save lives. You need to have something. And social media, if you want to use social media, using a professional, I learned this through many interactions. And the other day at a conference, there was a social influence. He was adamant. If you're going to use social media, you need to use a professional. You need to look like, it's professional. So it could be a student at university that's learning IT. It doesn't have to cost you thousands and thousands of dollars, and they'll be your advocate. But if you're having a campaign, then you should post 4 times a week. And have nice, engaging content during that time. And again, monitor and assess. So for example, you're putting up on Facebook, how many people are following this campaign? And what are the comments? Are they saying, well done, or we want to help, or you don't have enough likes? You notice that there are gaps. So that's just one example. Or radio, are people engaging with you on radio? Or are they coming to your events? Are the doctors and nurses coming to your lectures? So these are all ways you need to keep numbers. And why is all of this important? Because you need to be accountable. For example, you got a grant of X amount. Your funder will want to know, oh, really? You saw 2,000 people. So what did you do with the money that you saw 2,000 people? Well, we had an internet campaign. We had lectures. We did drama. So they want to see that. You need to show that you used the money how they expected, okay? And you can get feedback. You can do a little survey from patients and colleagues. So these are, and you also can continue your networks with your funders, your patients, with all the people that engaged with you. So I'd like to close now and acknowledge all the great support that I've had to put this together. My There's a student at university who helped me, Maram Badreen, without whom this wouldn't have been possible. And Dr. Shaheen for including me. Thank you again. And really to all the volunteers and patients who make campaigns possible, but also for pushing us to do more. So it's not a one-off, it's a continuous process. And at the end, I'd like to close with a quote from Jenna Kachola. Advocacy is empathy, compassion, and community at work. So if nothing else, that's my message that you need to take away. And good luck. Thank you very much. Bye from Jerusalem.